Hello, friends. Good evening. This is Dr. Puja Dewan, your show host and anchor on the show Legends of Medicine. Today, I bring to you a legend amongst legends, an astute clinician, a cardiac interventionist, a Padma Shri awardee, a researcher, a healer, a compassionate, empathic gentleman, and this is none other than Padma Shri Dr. Upendra Kaul. Welcome, Dr. Upendra Kaul, to the show.
Thank you very much, Puja.
You're most welcome, sir. It's a pleasure, of course. And I must introduce to the august audience that Dr. Kaul is the chairman at Batra Hospital and Medical Research Institute. He is also the dean in the field of academics in the same institute. You certainly, sir, don't need an introduction. Yet I have to introduce you to those who want to know more about you and gather more about you.
Make it brief.
No, sir, I wouldn't make it elaborate because as the journey goes on, there will be so much more that you and I will have to, we'll interact and we will share amongst each other. But as we flow into the show, my first question to you, sir, you are known as the healer. And it is not something which is bestowed upon you. It is something that you earn for yourself. So how do you feel when you are addressed as the healer?
Well, all these, qualities or properties are divine in nature. Everybody wants to be a healer. Every doctor, every healthcare worker, nurse, technician, everybody wants to contribute to the betterment of the health of the people they're treating in any form. So it just happens that, somebody strikes it little more than others. I very often tell people that there are two physicians, both are MD medicine, both secured good marks. And you would see that outside one's room, there is a 45 people standing all the time. Other guy is just looking at his, WhatsApp or something. He's not so busy at all. So both are educated. So I think it goes much more than just, knowing the subject. I think empathy, listening to the patients, listening to the person, even if he's not a patient, you think he's got, psychological overtones or, he's an anxious person. Doesn't mean that you brush him aside, you have nothing, go away. You listen to him carefully. And very often we find something hidden there and then, act on that and move on those directions. If you think that, he has got some kind of a depressive illness, all of us know that there are some good mild medicines to treat depression. Instead of sending him to a full-fledged psychiatrist, who, first of all, that term psychiatrist, puts in a shiver in the person. No, I'm a pagal ho gaya. So that kind of thing. So put in him some escitalopram or something, some clonazepam or something, and then bring him back and give him confidence. And then also look at his problem for which he came. If it is very obvious that he has a problem, his pressures are not being controlled, or his angina is not being controlled, or his diabetes is out of control, give him.
So what I have heard from you right now, I can tell you one thing, that there is nobility and humility which is flowing into your blood for sure. Because you see, we all take the oath, which is Hippocrates' oath, and we all want to, all are venturing into a noble profession. But I also see into you modesty. And whatever little that I have learned of you is that you have had a very modest beginning. And it's not been an easy journey. And it's not just that people who have modest beginnings make it big. But I would like to share with the audience that, yes, I mean, in the good old days, then you were hardly a 2.5-year-old child. You got discharged from Kashmir and you were born in Kashmir. You came to Delhi and you struggled. You and your family were in constraint of resources and were struggling in Delhi's Prem Nagar area. Would you like to relive that, and share it with the audience?
Yeah, I think you're right, partly right. I was born in Kashmir and I came to Delhi because my father came out in the first exodus of Kashmiri Pandits from Kashmir in 47-48 when raiders from across the border came to Kashmir. And my father being the only person who had done some college and he had done his BSB, LLB, and all that. Others were all in business, small time business, but they were quite, well to do in their own ways. So he came to Delhi to look for a job, got a job in an insurance company and lowly paid job, and we took a house in a place called Prem Nagar. Prem Nagar is near Shakti Nagar now and very close to Birla Mills. I don't know whether that
Yes,
mill
yes,
is
sir.
there, Birla Cloth Mill. And the place was all the employees of the Birla Mill used to be staying there because it was close and it must have been very cheap. That's why my father also went there because salary was very little. So, but at the same time, my mother, you know, I really, really, it's she who brought me up into this stage. And she guided me from that particular day. And they knew that they didn't allow me to mix too much with the children of those people. They were all abusive and all kinds of gully galoch and all that. So, with the result that I was at home in that one room, kitchen, room, everything, and the toilet and everything was shared with the same building, which had, 30, 40 people staying in the building. But that was okay. We never, thought that हम कश्मीर में तो अच्छे थे इससे. Nobody thought about it, and I didn't even know what was Kashmir. So from there we started our thing, and I still remember helping my mother in the kitchen.
I've seen a picture of your mom. I saw a picture of your mom. Yeah, I mean, she's a grand old lady. I mean, so graceful.
और मटर बीन के देता था, बैठा रहता था वहाँ पे, and tried to help her out because somehow a child of that age had some feeling that we are hard pressed and we need to help each other. And Kashmiris are meat eaters. We are non-veg.
Yes.
We relish non-veg food, and that there was a condition that you cannot eat meat in that building.
Oh.
अब कब तक रहते? So my father, he used to walk from Prem Nagar to Connaught Place for his office every day and come back. And nobody would do it today. Anyway, that was the time. And on his way back, there was a place called Pulbangash where these meat sellers were there. So he would bring some mutton and we would lock up the whole room, and cook it and then have it with rice. And rice was also, those were the days when we were in real difficulty in the city. Ration होता था वो लाल रंग का चावल, वो सेला चावल जिसको कहते हैं ना, smelling very peculiar smell because it was already kind of boiled partly.
Yeah, parboiled kind of red rice.
Maybe healthy from the standards of today, but that was not the rice which we used to it. वो खा के, and then he used to pack all the little bit bones, and next morning when he go to the office, he would take it and throw it somewhere, miles away. But mutton बनाते हैं तो कश्मीर में वो अच्छा मसाला डालते हैं, so it used to smell.
खुशबू sir.
खुशबू. And the other children in the house. Yes, no, not gushtaba. Ordinary कुछ भी मसाला सौंठ वौंठ डाली, but it has its own, fragrance we call it. So those children used to tell their mothers, respective people, ये पता नहीं क्या खाते, इतनी अच्छी खुशबू होती है. So then they used to come, आप क्या बनाते हो? My mother was intelligent. She said, "एक हम दाल."
Zafran. Escape it for saffron.
दाल बनाते हैं, दाल में हमारी स्मेल होती है. So then one day देखिए हमें भी वो दाल चाहिए. Then she made a dal and put some curry out of that dal into curry out of that meat curry into the dal and gave them, and they were rejoicing. What a dal! So वैसे शुरू हुए हम, but slowly, things started improving, and then we moved to a place called Jawahar Nagar. Okay. This is when I was maybe in 5th or 6th standard. तो फिर जवाहर नगर में एक कमरे का वो मिला, just in front of Karodimal College.
KMC.
Delhi.
Yeah, DU, North Campus, KMC.
There used to be a coffee house on the left of it. That was the first, real coffee house of United Coffee House वाले जो होते थे ना उनका.
And the other in CP.
That's right. Now it's in CP, but they used to have it there. तो उसके साथ में रहते थे. तो चलता गया काम, and I got into, I don't know whether आपने कहीं पढ़ा तो नहीं, I got into a wrong kind of a company in the
Oh, is
school.
it?
In the
Okay,
school,
because what I have understood
I
is
was a
that
goody
your
goody
mom
person.
made sure that amongst the Birla Mill workers and their children, while the neighborhood would be at it that you come out to play, you would mostly stay at home, you were hardworking, you would study, and you of course went on to your post graduation and you went to Maulana Azad, I
वो
guess.
तो बाद की बात है मैडम, उसी पे आ रहा हूँ मैं.
Acha.
How it happened. Yes, I went to Maulana Azad. That's a fact. But it went through a very, tumultuous route. What actually happened is that I went into a wrong kind of a company. One of my school friends, he was staying in Malkaganj. Malkaganj is next to Nagar. So we started skipping the school. And I was studying in Ludlow Castle,
Okay.
near Oberoi's Maidens.
Yeah, I know.
Okay, near the Exchange Road, Exchange
Yes.
Stores. उस area
It's a
में.
beautiful area.
Yes. So Papa used to give me, आने होते थे उन दिनों, एक आना या दो आना for the bus or whatever it is. We didn't go have a school bus. So, but I used to save that and walk from Jawahar Nagar over the ridge, a shortcut over the ridge where Lieutenant Governor and the states now, Delhi का
The
ना, वहाँ,
secretariat.
yes, तो वहाँ से स्कूल पहुँच जाते थे. And then we went and saw Jungly movie.
Shami?
Shami Kapoor. And we saw it 5-6 times.
It was iconic at that time.
कश्मीर के सीन थे ना सारे.
Absolutely, sir. Absolutely.
Kashmir was always in my blood. So then what happened? Now I'm telling you real truth. What happened in 8th class? In 8th class, I failed.
Mm-hmm.
0 marks in mathematics, pathetic marks in some other subjects. And my father was a very sensitive person. So I could not dare to face him that I failed. So what I did was to make the progress report. Progress report को I think ₹1 में मिल जाती थी.
Another mark sheet for yourself.
Marksheet अपने आप बना ली, अच्छे
And
marks.
those days the parents were supposed to sign also.
Yes, अच्छे marks.
And that was your assessment day and spanking day.
Yes, अच्छे marks लिख के दे दिए उनको, वो तो दे दिए, तो लेकिन कैसे काम चलेगा ऐसे? अब 8वीं से 9वीं में तो हम पहुंचेंगे नहीं, है तो 8वीं में. तो इतने में क्या
Those days they have a system of automated progressing you till.
नहीं, ऐसा कुछ नहीं था ना, ऐसा कुछ नहीं. There were no apps and all that. So I had a younger brother. I have a younger brother who is 13 years younger to me. He had just born.
Oh.
Obviously, 5वीं 6वीं में कितना बड़ा होता है ना. तो we used to go to Kashmir every year in summer. 15 May से 15 July छुट्टी होती थी ना. So that year when finally I showed the progress report to him that I failed, and he hit me. And he first hit me and then he hit himself. सिर्फ अपना माथा पीटा कि मेरा बच्चा ऐसा भी हो सकता है, झूठा और 0 number लेके. So now the only punishment I can give him is that Shankar and my mother would go to Srinagar. But
that's your younger brother.
Yeah, my younger brother. And this bugger cannot go. He has to rot here in Delhi heat. Oh, that was the time which I got really, hit. Oh, they will deny me Kashmir. I will also show them that I can study. And from that time, I started studying. वो स्टडिंग ऐसे कि मैं पूरे बाजार भेजते थे, ये लेके आओ, तो मैं रास्ते में किताब खोल के पढ़ता रहता था. दूध की हमारी वो दिल्ली में स्कीम की वो थी.
Those glass bottles जिसमें दूध आता था.
हाँ, बूथ था सामने ही, तो उसमें लाइन लगती थी, तो मुझको ही भेजते थे, मैं जाता था किताब लेके जाता था.
DMS they used to call it? Delhi Milk Dairy, something like that?
No, DMS, Delhi Milk Scheme.
DMS, yeah.
Delhi Milk Scheme, much before Mother Dairy.
Yes,
Delhi
sir.
Milk Scheme.
The glass bottles with the aluminium foil on it.
हाँ, ऊपर से वो था उसका silver foil.
At least I can relate to it. Somewhere I may not be your generation, but yes, I have lived all that in my childhood.
तो फिर वो बहुत ही सुबह जाते थे ना, it was used to be twilight kind of a thing. उसमें मैं वो लैंप होता है ना, वो स्ट्रीट लाइट,
yes sir,
उसके नीचे बैठ के किताब पढ़ लेता था, रट्टा मारता था इम्तिहान के लिए. So anyway, I did okay then, and then went to 11th and had reasonably, the 65% marks used to be very good marks.
This should be almost like a distinction. I mean, it was rare.
Yeah. And with a distinction in physics or something, 75 marks. So that was I threw, and after that it was okay. And then I leave it to you. फिर तो धीरे 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 करते गए कुछ ना कुछ ठीक.
सर आपने कितने हम्बली बोल दिया कि रट्टा मारते थे, बट पुस्तकीय ज्ञान से ज्यादा वास्तविक ज्ञान है आपने, for sure, because it's not just the kind of work that you have done in terms of reality of life. I mean, it's astounding. But I'll still come back to where we were, and then you went to Maulana Azad.
I went to Maulana Azad Medical College.
Did your MD DM from there as well?
Yes.
And you had the distinct achievement of being the first Kashmiri to obtain a DM, a doctorate in medicine in cardiology, doctor in medicine in cardiology. That's right.
I'm the first person from Kashmir who got DM cardiology. And then I wanted to go to Kashmir at that time. Because those days, after DM cardiology, your job prospects were very limited. That's why many people did not go into DM, because there was hardly any cardiology hospitals. I'm talking of 1978.
In fact, DM also did not exist a few years before that, and most of the people
Dr.
who were
Suresh
MDs.
Gupta and Dr. Ramesh
I mean, if you look at CSI today, Cardiac Society of India, the senior people who are MDs, they have not done DM. It never existed, but they have been the fathers of the learnings that we have got.
DM cardiology was started in Delhi in All India Institute of Medical Sciences by Dr. Suryavi Roy. At the same time, in CMC Vellore, it was started there by one lady cardiologist. I just forget her name. Vaitilingam, Dr. Vaitilingam. So these were the only two places. Then Dr. Padmavati started the DM cardiology in GB Pant Hospital, because she spent her life, most of it, in Lady Harding Medical College.
We lost her lately.
I know, and we lost her of COVID.
Yes. She
went off.
Geriatric age group and elderly geriatric is challenging.
That's right. So then she moved from Lady Harding to Maulana Azad Medical College, and there were two associated hospitals with that officially, GB Pant and Irvin Hospital, which now is LNJP Hospital.
LNJP. I'm an alumnus of that as well, sir.
Yes, so that used to be called Irvin Hospital.
Irvin Hospital.
उसका नाम फिर बदला जबकि उसका लोकनायक हॉस्पिटल और दूसरा
It used to be Lady Harding, Lady Irving, King George and King Edward, and that's the
hospitals. Go to their wards, if you've seen, they're like huge long halls, like a parallelogram. One side one
dormitories, long dormitories, sir.
बिल्कुल, एक साइड में एक यूनिट, दूसरी साइड में दूसरी यूनिट. Dr. Nair's unit, SK Nair's unit in surgery, Dr. Anand Prakash's unit. Dr. Chutani's unit. Dr. Vaishnav used to be the professor of medicine. He had a separate unit. So that was Irvin Hospital. So
I'm alumnus of Lady Harding, so I can identify with that as well.
That's right. And she had a cardiac lab in Lady Harding. Those days, there was no angiography, but they used to do some right heart study and all that when she had come back from Massachusetts, US. So she was doing, but she moved to this place and she became the director principal of Maulana Azad and the associated hospitals. And finally, she, started cardiology in GB Pant Hospital. GB Pant Hospital initially was a very, building was there, but a very small hospital.
That's where your wife, Dr. Mrs. Kaul,
yes,
has been working in GB Pant.
That's right. And GB Pant had only a gastroenterology unit of Dr. H.K. Chutani and a psychiatry unit and a neurology unit of Dr. Janaki. Professor Janaki was the younger sister of Professor Padma.
Okay.
And then she brought in cardiology there. And then came Dr. G.D. Gupta. He's still practicing in Tirath Ram Hospital. Now he's very old, a very good physician. Dr. M.P. Gupta, who is no more now. Professor M.P. Gupta as the head of cardiology department. And then came Dr. Khalilullah.
Okay, Dr. Khalilullah. The hospital on Lajpat Nagar is also...
Now he has a hospital. He also later became the director of GB Pant
There's a
Hospital.
heart center in the
Heart
Lajpat.
Center, just opposite Mulchand Hospital.
Yes, sir. Yes, sir.
Now
Next
his daughters, Samina, she handles because Dr. Dilda sits at home and he's also, scared of COVID. And for the last 1 year, he doesn't do much practice. So GB Pant Hospital. So what happened is that I did my MBBS and then did my MD medicine. In MD medicine, I was never a chamcha. So Dr. Vaishnav and Dr. Chutani and others, they used to take people whom they knew very well because they used to be after them in the rounds and, making them happy in whatever way. So, I was a very, what is called as a shy person. I'm still a shy person, but extremely shy. I'll do my work, do it properly, but ये पीछे पीछे घूमना नहीं आता था. So with the result, when MD, allotment of the boss for the thesis, MD की बात कर रहा हूँ. Thesis का जब time आया, तो मुझे कोई लेने कोई नहीं तैयार वहाँ पे. Then they gave it to me, Dr. D.D. Kulpati, whether you have heard of him, Dr. D.D. Kulpati, and he just became eligible for taking MD students. So he had no experience of guiding people.
So he became your guide.
He was told that you become his. I was told he's your guide. So I went there. Dr. Kulpati said, आपने हमारी वो देखिए जाके पल्मनरी लैब हमने नई बनाई है. ठीक है, बताइए कहाँ. चला गया, वहां देखा वहां 2 खाली डालडा के डब्बे थे पुराने पड़े हुए बस. तो कहा इसके हम वो बनाएंगे कुछ वो पल्मनरी फंक्शन टेस्ट करने. मैंने कहा मारे गए यार, कहाँ फंस गए. So then I was told, why don't you try GB Pant Hospital? Because they are entitled to taking students for MD. So I went to Dr. Padmavati. She already had one person. Then she said, you go to Dr. MP Gupta. So Dr. MP Gupta was good enough to take me as a MD student and gave me a thesis topic called systolic time intervals. So I used to do my thesis there. But our MD program teaching वगैरह तो मौलाना आजाद की ज़्यादा तो वही होती थी ना एरविन हॉस्पिटल में.
Right.
So I had a little connection with Maulana Azhar, but at the same time I did my MD with the MD thesis in cardiology. So from there cardiology started with my blood. And in 75, I passed my MD medicine. And then was the question whether to do DM or something. Everybody said, Dimag kharab hai. All of my good friends and all that, they went into, some became lecturers, registrars, or started their own clinics, hospitals. So, but Dr. Padmavati caught hold of me one day and she said, you're not going to go anywhere. You're going to become a cardiologist. I've been noticing you. I've been watching you. You have to join cardiology. So I became the 3rd or 4th DM cardiology student of Delhi University.
Oh.
Senior to me were Dr. Ramesh Arora. She's still practicing in, I think, Dr. Purushottam Lal's one of the metro hospitals.
Yes, yes.
And others were Dr. Balakrishnan and others. They went to Trivandrum in the Sri Chitra Tirunal Hospital in Trivandrum.
I've been there. Yeah. I did some part of my observership and training then Sri Chitra in Trivandrum.
Yes, a nice place. Brought up by a cardiac surgeon, he was in Safdarjung Hospital for some time. A cardiac surgeon who built that hospital, Sri Chitra.
Dr. Lal and I are neighbors, next door neighbors.
Okay. But Dr. Lal's story is also a very fun, interesting story. He was in Apollo Hospital in Chennai before all this metro started. And then Dr. P.C. Reddy wanted to open Apollo Hospital.
Pratap Reddy.
Yeah, Pratap Reddy. And I was in All India Institute of Medical Sciences. As, this was in 96 when he started to plan this hospital, built up this Indraprastha building. And then he wanted cardiologists. So he invited me, Dr. Ashok Seth, and 2-3 more cardiologists for a very nice dinner at in that, Moria Sheraton 7th floor or somewhere. And Purushottam Lal also came in there and he said that he would also join. He joined Apollo. We did not. I went to Batra Hospital in 97. That was my first stint in Batra Hospital. Because there was one Dr. Dikshit, he said, you come, we'll give you a new lab and everything new. From All India Institute, I went there. But Purushottam Lal, within 6 months of his stay in Apollo, was basically, I think, from the business community, had some money also. He started the first metro hospital in Noida. And then he never looked back. Now he took know his empire all over.
Sir 11 Noida.
Yeah, very a nice person, good at his hands, but very smart, and in marketing is terrific. See,
So coming back
Yes.
to you, the audience certainly would like to know what your expertise in procedures has been. Percutaneous cardiopulmonary bypass, rotational and directional atherectomy, coronary stenting, percutaneous laser myocardial revascularization.
Yeah, let me
Known
come.
procedures. Yes, sir.
Let me come one by one. When I did my cardiology DM, that was 1978, there was no angioplasty existing that time. There's no
Sure.
angioplasty being done. Dr. Grunzig in Zurich performed the first case in 79. And then we came to know there is something called angioplasty. People used to, you know, laugh at this angioplasty business. How the hell can you open arteries by entering the artery and putting in a wire and putting in?
Ballooning,
There were no
stenting.
there were no stents that time. There were no stents that time. Simple balloon, very crude wires and all that. So he came in, and then I was at that time interested in electrophysiology because that was a thing which distinguished armchair cardiologist from somebody who does something, non-surgically. So I went into electrophysiology, started pacing and pacemaker implantation,
EP.
and EP. And then I was awarded a fellowship in Melbourne. So I went to Melbourne in 83, and there I saw angioplasty being done. So I shifted from EP to angioplasty. Dr. Peter Valentine.
In fact, a lot of interventionists, if given an opportunity into EP today, usually the gap is that there are a lot of cardiac interventionists who actually want to get into EP, but it's the other way around for you. From EP,
That's
got
right.
back into intervention.
Yes, so I started learning angioplasty and then requested Dr. Peter Valentine when I was returning back if he could give me a few guide wires, old guiding catheter, we would sterilize it and all that, and something. He was very happy to give it.
Tell them about reuse of guide wires and today people would.
And then I came and started our angioplasty program. Dr. S.C. Manchanda, who was much senior to me, he had done one case, but then it was just one case. It came in the newspapers and all that, but उसके बाद उतना ही रहा. ठीक है. तो एक साल के बाद मैंने शुरू करी, सामान में लेके आया था, and then I did and started, and then S.K. Gupta, who is in Apollo Hospital.
Apollo, yes, sir.
He was in Railway Hospital. No?
I happen to have had the fortune of working in Apollo, Indraprastha Apollo Hospital, Sarita Vihar. Hence familiar with the gentleman that you are.
He's a very nice person from Meerut. He actually was in Railway Hospital in Perambur in Chennai, which was one of the very important cardiac surgery hospitals.
Where Dr. Cherian was also there?
Yes, Dr. Cherian.
Where he performed the first bypass surgery in a hospital, right?
That's what, senior Cherian. That is TJ Cherian.
Yes.
Not KM Cherian. KM Cherian is from Madras Medical Mission in hospital, but this is TJ Cherian. And other Cherian was also a part of that only. But this was TJ Cherian, who did his cardiology post-graduation and then did cardiac surgery also. Very few people would do cardiology and then cardiac surgery. And then he became a surgeon. So S.K. Gupta was there. And then he joined Apollo Delhi. And, he is, again, a very modest kind of a person. But has this good clientele, largely from Meerut and now also from, now Apollo has many, many cardiologists. So, कौन कितनी अच्छी इंग्लिश बोल सकता है उससे भी फर्क पड़ती है तो. So that is how I started balloon angioplasty. And then I started thinking that what about people where the heart function is very bad? And surgically,
heart failure are we talking about?
Very bad heart. What we call as ejection fraction, 20%, very high risk for surgery. We didn't have the gadgets we have today like ECMO and other, big machines. So how about handling them? Then in United States, in Washington, there's a hospital called Washington Adventist Hospital, Dr. Fayaz Shaw. He was a person who had worked on percutaneous cardiopulmonary bypass. You go from femoral artery, you go from femoral vein, put in big 16 French cannulae, and put the patient on a cardiopulmonary bypass machine, a small one, with a membrane oxygenator, and do the procedure. So I was very impressed by him. So I said, let me go for a few weeks. So I went there and he started doing this. And then I saw him ringing up somebody and talking in Kashmiri.
Ah,
I said, oh my God, this gentleman is, because in America, the slang changes. So I thought it must be, I thought, Fayaz, shawl, it could be anything. So then I told him, I'm also from Kashmir. So, oh my God, you didn't tell me that. I said, how could I tell you? I did not tell that I'm from Kashmir, first of all. So anyway, then we were very friendly, pally. And then I came back and started this, what is called as percutaneous cardiopulmonary bypass in All India Institute of Medical Sciences. First time in this part of the world, we did that and saved a number of patients by this. Then came an era that some of the patients who have very bad arteries, thin diffuse arteries, not candidate for bypass surgery because the vessels are so thin, you can't do angioplasty in them, yet they are getting a lot of angina, they can't walk. So we thought how to do it. And then, the reptiles,
yeah.
snakes, and, that kind of
Blood
animals.
thinners, they release blood thinners.
No, 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 no. They do not have arteries.
Okay.
Their heart is like a sponge. So they have got minute, what is called as holes in the ventricles. When the heart pumps, they suck the blood and oxygenation. So that was the basis of laser technique.
Okay.
So
Okay.
make holes in the heart. So earlier surgeons started doing it in one, they put in two grafts and some of the areas of the heart where the arteries are bad, drill some holes, make some holes by laser. So we thought, why don't we do this by in the cath lab by making special catheters? So we did it, and Dr. Fayaz Shah again was interested in this, so he came down to India because it was not an FDA approved procedure, and we did and published two big articles, two big series on that, and that was laser. Ultimately, the technique failed because there was a scientific proof of a procedure has to be you compare it like you compare a drug with a placebo. Here we compared it with a sham procedure. Take it
Okay.
to the cath lab, do something without doing anything. And it was seen that even sham procedure people were benefited. So it was more
Oh,
so it was more of a psychological and placebo effect of the
placebo
procedure.
effect. Yeah. Yeah.
Placebo effect of the procedure. But then I started it. Then came bare metal stents. And angioplasty, balloon angioplasty used to be effective in only about 80% of cases. Others, sometimes you had to go to send the patient immediately to surgery because the artery dissected. You dilate the artery with the balloon, and the injury is so much
The
that the
dissection
vessel
in the wall happens.
and vessel collapses. And that is the reason when we used to do angioplasty in 80s, we had to keep the one of the operating rooms ready. I remember Dr. Venugopal was our chief of cardiac surgery at All India Institute of Medical
You
Sciences.
were working at All India Institute as
Yes,
well as a
yes.
professor.
Yeah. I worked from 83 to 97 in All India Institute. I was a professor of cardiology towards the end of my last 3-4 years, and I'll tell you why I had to leave the All India Institute of Medical Sciences. So then he used to say, okay, Upendra, you start very early in the morning, 8 o'clock. We will not start our first case till you finish. Finish by 9, 9:15. So सुबह 7 बजे पहुंच के angioplasty we used to do and very often succeed, sometimes fail and send the patient to surgery. But then came the revolution of stents. That means after dilating with a balloon, put in a stent which was mounted on a balloon, you expand it and the stent remains there. So these crashes and acute problems vanished with the stent. But then came the problem of this restenosis in the stents. That means the
Right.
tissues would grow within the stents in about 20% of patients. In
Because of the
diabetics,
injury and the trauma, the clot
yes,
would get back.
more healing.
The
It is
blood
because
thinners came in.
no, you put in a stent, it traumatizes the vessel, and acutely it's very good, but then the vessel starts healing. And that healing sometimes
Healing.
becomes like a keloid. If you injure yourself,
Another blockage.
you can have a small scar
Yeah.
or you can have a big scar. Big scar is a keloid.
Right.
So when this started, so especially in diabetic patients, smaller arteries, long stents, this was a problem. So then in 2002 came the drug-eluting stents. And I was one of the first persons
Yeah.
to start drug-eluting stents in this country. And now all the stents we use are drug-eluting stents. We have better drugs,
All
safer
this
drugs.
stuff.
So that is how present-day technology of angioplasty
I was
evolved.
a little girl, and I remember as a little girl,
Yes.
don't know how little, but yeah, you were then working in Batra Hospital, and there was this relative of ours who lived abroad and who came in and who got admitted under you, and we came to know there is a heart surgery without opening the heart.
Okay.
And there is this gentleman called Dr. Upendra Kaul who is going to put things inside. And then there was this big discussion about, are we going to put a metal one or are we going to put a less metal one? Are we going to have the drug one? We're not going to have the drug one. How much the cost of this is, how much the cost of that is. All that discussion got into my brain. When I came to know that I am going to have the fortune of interacting with you and interviewing you, those memories came back to me. And what even came back to me later was that maybe a decade or so later, another relative or friend that we knew who had an oral cancer surgery in the hospital. And this gentleman got operated there. And again, I was told Dr. Kaul is operating. Now, 10 years later, when I finally became a doctor, I understood that Batra Hospital, its presence, your popularity is so synonymous that no matter whether you are psychiatry, gastroenterology, oncology, ENT, the presumption is Dr. Upendra Kaul is operating upon you. That's the kind of faith that you have built into the general population. Of course, to explain to people that there's a difference between a cardiologist and a cardiac surgeon is a different story altogether, and to explain what intervention means. But here, ENT, oncology, cardiology, cardiac surgery, all was so synonymous with you, and I think continues to be synonymous with your presence there. We are a little short on time. We are a little short on time. We will, of course, revisit a lot of things that we've been talking about. But I would like to come back to. I would like to share with people how you were. You became popular as a healer. The audience would certainly know that you are from Kashmir. You are a Kashmiri Pandit. We know that the exodus happened. There was insurgency. Loads of Kashmiri Pandits, Hindus were dislocated from their stable bases. They lost out on their ancestral homes. A lot of them moved to various parts of the country. Life was very difficult. At that point in time, Dr. Upendra Kaul was in Delhi. He was working at All India Institute. He was the professor there. So such was, of course, when we all move, it's not just a question of dislocating or the trauma of dislocation, but it's also about monetary impact, and health also gets impacted, whether directly or indirectly related. And loads of Kashmiri patients did come to Delhi, and they sought treatment. So the kind of service that you gave out to them, and that you openly said so that if there is any Kashmiri who has an illness, I will try to make sure that we can cater to the health services, get a bed, get the service for that particular patient, and try and accommodate and do it in All India Institute. And when loads of patients started coming to you and they started getting services which were especially from your field, and they got healed, and that kind of changed the entire aura and persona and brought in the picture of compassion, empathy. And you know what they say, कि इनके हाथों में तो शफा है. And that, of course, if interpreted in the media, would bring you forth as a healer. I mean, what was the journey, sir? What was your feeling at that time when people bestow you with so much credibility?
See, that is the turning point. One of the I have many turning points, but I told you of my turning point of ninth class. This was the other turning point, was that in mid 90s, I would say around 93, 94, when the health services in Kashmir were totally collapsed because of the militancy. Patients had no place to go. Some of them who could not come down to Delhi perished there, but many could come to Delhi. And I was in All India Institute of Medical Sciences. They would be standing in a long queue of the OPD. So I would go out of my room. Our OPD used to start in the afternoon at 2 o'clock. I used to go and figure out Kashmiris, and there was a boy from Palampur in Himachal who was making the cards. I used to tell him, see, patients who are from Kashmir, they have to be, and I used to talk it openly, nothing in his ear. उनको आप जरा जल्दी आज मैं देखूंगा ही देखूंगा 10 भी बज जाए मैं देखूंगा क्योंकि उनके पास रहने की जगह नहीं है एक दिन उनका ज्यादा रहना मीन्स 1,000 रुपया 2,000 रुपये within those days so I had to see them so everybody agreed nobody would jump the queue but I would see everybody and I saw one day one patient in the queue writhing with chest pain I got an ECG done it was evolving heart attack so I took that person in the wheelchair we took him to the cath lab and I did angioplasty getting up from open. So that was the kind of work I had to do that time, and that obviously made me people liked that people felt that I have a heart for them.
A doctor with healing hands and a
And
heart
then
with.
I'll give you one example. Even after that, the patient came and he had no money for a stent. So I said, no problem. कोई बात नहीं उसको नहीं बताया I told them मैं दे दूंगा इसके पैसे वो कर लिया एक pacemaker replacement I gave it to him and then when I went to Srinagar that gentleman came back and said हमारे पास तो पैसा है नहीं लेकिन हमारे पास जो है and he got very fond of nadru means this lotus stem भें जिसको कहते हैं वो कश्मीर में बड़े अच्छे
They
होते हैं
fry it and also make
yes, तो
nadru.
वो एक बंडल वो लेके आ गया कि ये मैं दे सकता हूँ आपको
I'm very fond of Kashmiri cuisine, sir. I also have a close people, family who were in Kashmir, who got dislodged, attempted to go back, dislodged.
And that's how, the relationship was built. And then I was asked by Chief Minister that time, Mohammed, Mahbooba's father, Mufti Mohammed Saeed, that you come and he opened a government hospital room for me and you see patients. And then I started seeing free patients. Then he said, you're a fool. You charge people who can afford. What is this? ऐसे नहीं होता है तो बहुत सीधे हो anyway and now I'm just since the time is short I'll just tell you what I'm doing now
I'll bring in that question, sir, but I want to tell the audience that Dr. Upendra Kaul is a high profile doctor by definition. He has had the fortune and the skill to treat the two former chief ministers of Jammu and Kashmir. That has been Farooq Abdullah Sahab and also Mufti Muhammad Saeed. And he has, also traveled the breadth wherein because of his humanitarian deeds and because of treating people in positions of power, he could also, as a kind of mediator, on the suggestion of the governments, whether it was Vajpayee government or Indira Gandhi's government, could actually reach out to people on the other side of Kashmir, the separatists. And one amongst them is Yasin Malik himself, who was also your patient. So it's for Dr. Kaul, it's about medicine and humanitarian service, be it for the Kashmiris or for the Hindus or for the Muslim or for the people in power or for the poor, for the separatists. So what would you like to say about it?
Yeah, you're absolutely right that, I was, Yasin Malik was in jail in Tihar. And then suddenly government of India thought that, needs to talk to him. And how could they talk to him? So Mr. A.S. Dullat, who was the RAW chief that time and, CBI chief, he used to come to my home in the morning. I was in All India Institute of Medical Sciences. I was the first person to reach the hospital, so I would leave by 7:30 so that I am there before anybody comes. So I saw this gentleman sitting outside the home. Then I asked him, "What do you want?" He said, "आपके पास 5 मिनट है?" मैंने कहा, "आज तो नहीं है यार. अब चलो कल आप थोड़ा और 15 मिनट पहले आ जाना." So he came at 6:30 next morning. And then he introduced himself that I am AS Dullat, ऐसे ऐसे करना है. मैंने कहा देखो मैं तो नहीं ये कर सकता ना, मैं कैसे उसको रिलीज करा दूंगा. नहीं उनको वाल्व की प्रॉब्लम है कुछ. मैं कहा तो आप ऐसा करिए ना, एमएस को पास जाइए, उनसे कहिए कि उसको पेशेंट को बुलाएं, मैं देख लूंगा. So that is what he then did. Dr. Safaya was the medical superintendent of All India Institute of Medical Sciences in, I think it must have been 93 or 94. And he brought him and he had aortic leak. He needed surgery. So we got him operated. And on the consent, he became so, fond of me. Who? Yasin Malik.
Yeah.
Yes. And
they say that there was a time when he was not drinking, eating anything. And he said, if it's only Dr. Upendra Kaul who will bring me that glass of water, am I going to drink it? I mean, that's the kind of faith.
Yeah, that was a relation. That is a patient-doctor relationship, which was misunderstood by some people, and they took me to NIA also for that. You don't know that story, probably.
I'm aware, sir.
You're aware. Okay, let's not bring in then that. Anyway, so Yasin Malik, it was all because of the empathy and, speaking in Kashmiri and showing concern that it all happened. And his family knows me, he used to come to my place whenever when he was free. My mother was fond of him because of his wife, who is in Pakistan now, Mushal. She used to come and she used to tell my mother, "Please make damalu for me."
Kashmiri damalu.
Yeah. So that only meant friendship of doctor-patient. It has nothing to do that I am also soft on separatists. For me, everybody is same. Patient comes is a patient.
So you have stated in one of your interviews where you were asked, what is Dr. Upendra Kaul's concept of nationalism? Mm-hmm. And I can say with pride that you said that if you care about your country, that's what you said, quote unquote, if you care about your country, work hard and increase the output of your work, that is nationalism for Dr. Kaul. Am I correct, sir?
Absolutely. You do excel in what you are doing. You don't have to, barge into other territories. जो आपको मिला है, जो आप कर रहे हैं, उसको अच्छे से करो. Isn't
True.
it?
Yeah, sure. Absolutely, sir. And you are such a hardworking gentleman. I mean, they say you get up at 6:30 in the morning, you routinely work till 12:30 30 minutes past midnight. I mean, that's what your schedule has been all your life.
Yeah. That's it.
In fact, the audience should also know that Dr. Kaul, when you were in AIMS and when the exodus happened, it was not just the patients that you treated, but amongst the Kashmiris who came to you as patients or otherwise, I mean, at least 100 odd people, you helped them get an employment or a job. Yes. How did you manage, sir?
Yes, that time I had actually was in Badra Hospital now, that time. I had to leave All India Institute 1997. 96 December was my last day because, my children were growing and I didn't have the money to, pay their big fees. My daughter got an admission in Pune in MBBS and they needed 90,000 rupees per month in a private place. I didn't have that. My salary was 20,000 rupees. So, but idhar-udhar se kahan se lata paisa? Son wanted to do MBA in Australia, demanding children. So I said, it's better for me not to go and ask for money from industry and all that. Just leave it. Go to a private hospital. And Batra Hospital always had a charitable kind of this thing. You could treat people who don't have money with very little money.
They are trust hospitals. So they have a combination of, doing philanthropic work, charitable and outright private.
So I joined Batra Hospital that time and that's how children could study. And so that was the reason I had to leave.
So what do your children do today, sir?
My daughter is a well-known neonatologist in Pune.
Okay.
Amita Kaul, and my son is a vice president in Citibank in Mumbai.
Oh, interesting.
So they're doing quite well. There are many vice presidents, but he's one of them.
Sir, but the on your own footing, you have been the former president of the Cardiological Society of India (CSI) and also former president of the SARC Cardiac
Yes.
Society. Anything that you can recall as a specific
Yeah,
incident or
whenever
your contribution?
I used to work passionately. So, when I was senior enough to become the Cardiological Society of India president, I also applied for it, and everybody withdrew his papers. It was, of course,
Uncontested,
it
unanimous
was,
presence.
it was uncontested, and that is the reason. Many people, loved me, liked me, and I was always straightforward. And in one of the meetings, when price control of stents had not come, now there's a
Right,
price
yeah,
control of
yeah,
stents.
yeah. Modi
Drug-eluting
ji's
stents,
government brought in price
yes,
control on many drugs, especially stents, one among
drug-eluting
us.
stents used to cost a fortune,
Yeah, yeah. One
and
and a
then
half lakh also for
yes,
194 types in one stent as well.
yes. So, and then I was sitting as the president, and they asked me, let us have a meeting how to ask the government to reduce the cost of the stent. It's a piece of metal. I said, yes, we can do that. We can draft a letter. But doctors, we first have to say that we should not be asking for a commission from the stent company because it has become a disease. In many professions it is there. वहाँ जाओ तो वो कट मिलेगा, यहाँ जाओ तो वो कट मिलेगा, CT कराओ तो वो मिलेगा, stent लगाओ तो वो मिलेगा. It will become a routine. So I said, how can you ask the government when you yourself are not willing to give your cut? You have to first become, saints. कि आप कट के बगैर काम करोगे तो वहीं पर खत्म हो गया. Nobody. अच्छा ठीक है फिर अगली बार बात करेंगे. ठीक है. So that's how. But then Modi ji came and then they brought down the prices, and today
So
stents cost.
today I am told that you are the Dean of Academics at Batra Institute, and you're also involved academically as an adjunct professor at Jamia Hamdard
Yes.
University, New Delhi, and at Amity University, Noida
Yes.
as well. So what is the kind of role that you play there in terms of academics, and how much does academics pull you into it? And I must share with the audience that Dr. Kaul has also co-authored with Tandon the textbook of cardiology, which is considered the Bible in the field of cardiology. So, sir, some light on your academics, your book, your contribution into the other universities.
Yeah, we have got now PhD students. One of the PhD students under me is working through MIT, although working in my department in Batra Hospital, Priyadarshini, on thyroid, hypothyroidism, and acute coronary syndrome.
You're the co-guide in that project?
I'm the co-guide. Similarly, there are projects from that hospital across the road.
I'm also, sir, one amongst the odd medicos who went on to pursue her PhD.
Okay, yeah. So similarly, from the Jamia Hamdard, I go there, I teach them, I take classes for them, and they like somehow over the period of years have become a good teacher, and that's why people say that you teach very well. So teaching, my principle is keep things very simple. Don't go for very complex things. Basics, simple, repetitive. Repeat 2-3 times. Emphasize what is very, very important, and then finally give them the take-home message. So that's how you teach.
I think the icing on the cake that you must be putting would be your clinical experience and being an astute clinician, because that is what is the actual thing. And books write a lot of things, but what is the practical thing? I mean, that speaks volumes.
And narrating one of the cases you have seen and who did well, and one of the cases who did not do well. If I had done this, possibly this would not happen. So let people not repeat the same mistake again.
And what about your textbook, sir?
Textbook, we joined together, Prabhakar, me, and a few colleagues from All India Institute. We wanted to give a tribute to Dr. Tandon because he was a great teacher, Professor Rajan Tandon, and wrote a textbook which is in 2 volumes, edited it, and it's doing very well because it is Indian aspect of various. You can read Braunwald and read the textbook from US, but that what we see in our context in heart failure, rheumatic heart disease, anything, adds an addition to that every chapter. So we worked hard for that. That's how one has to spend time after dinner and sit down when no phone call comes and read and
The
write.
hardworking that you are, and it's acknowledged.
Right.
You're also the editor-in-chief of Asia Interventions,
Yes.
joint editor of Euro Interventions, and course director of AICT Asia PCR in India Live.
Yes.
Could you tell us something more about it?
Asia Intervention is a journal which is for intervention cardiologists of the Asia Pacific region. Previously, it used to have 4 chief editors. This year, they decided, everybody said this 4 business doesn't work because everybody keeps on shifting his responsibility. So we'll have only one. And I said, let's make one. Everybody said, you are going to become.
Unanimous again, sir?
Unanimous
Too many
again.
spoiled the broth. You are the unanimous choice yet again.
Editor-in-chief of Asia Intervention, which is a challenge. But we do work every week. We have a meeting of the board of Asia Interventions, how to select deputy editor and this thing. So that's one. India Live is a meeting which was again conceived by 3 or 4 of us, one of them me, that if America and these people have a meeting, why India with, so, we do 40 lakh angioplasties a year. Why should we not have it? So we formed it, and every year in the month of last week of Feb, we have this. Unfortunately, pandemic did not allow to have a meeting, but I'm one of the course directors of that. Similarly, there's a French meeting, very popular meeting, and I'm one of the course directors of that also. It's an international board. So, that's how
As we come to the close of this session, I am not going to give up on a few questions that I want to ask you.
Please go ahead.
The Padma Shri that you received,
yeah.
How did it make you feel? How do you relive it? What sense does it bring into you?
It makes you feel good that, all you have been doing. As somebody has been watching you and, giving you recognition, and anybody, if you get a pat on the back, you did well, you feel happy. So it's a, thing which makes you feel good and at times proud also. Okay, my work has been recognized, but you never work for Padma Shri, it just comes, it came,
That was 2010, sir.
That was 2010, yes.
Yes. There is a biography which has been written on you.
I'm writing my biography.
Autobiography?
Autobiography.
Okay.
And I'm coming towards the end, which I wanted to end with is right now, I have me and my like-minded people are visiting all the districts of Jammu and Kashmir, holding free camps there, checking them, optimizing the BP, giving them, optimizing their sugars. We find that 50% of hypertensives in these peripheral areas are not at all in control, even if they're taking drugs. Half of the diabetics, their sugars are high, their cholesterol, triglyceride high. So we give them teaching, education. But then when we realize that, okay, you're going on to visit and tell them get this thing done, that thing done, where do they go? They go to all kinds of hospitals and they get, sucked in. So we just started on 10th of this month, last week, a Gauri Heart Center. Gauri is my mother's name. In the center of the city of Srinagar.
Yeah, right.
3 of my students who will be working from morning till evening. It can't be free, but top line cardiology equipment, modest charges, and whatever we make goes to the Gauri Fund Trust, and for which we will be doing the camps and other things. And I'll be going there 3 times, 4 days a week, 4 days a month, 5 days a month to supplement them because people want to come and show me in large numbers. So they don't have to come to Delhi.
So your heart is still in Kashmir, isn't it? You do visit Kashmir, and a few years back you did buy a house for yourself in Kashmir, which interestingly is taken care of by your neighbor who is a Muslim.
Yes. Yeah.
So how often do you visit? What brings back those memories? And if you had a dream wish, what would that be?
See, I made a house 5 years ago because my mother, before she went away, always used to say that we should have a place of our own in Kashmir. So in order to fulfill her desire, plus I was always, Kashmiri at heart. So I built a house called Gauri Manzil, in
Okay.
Kashmir, named the house after her, and it's all surrounded by my friends. Obviously, Kashmir is a Muslim majority area, so I don't, differentiate between religions. But obviously, they look after it. They look after it so well. When it was made, also, I was not there sitting there. They used to supervise the construction, design, and everything. And you be my guest is a nicely made small house. When you talked to me that day, I was in Srinagar when you said that. When we talked last week,
Right, right, right,
I
sir.
was in my house in Srinagar,
Oh, how nice.
sitting on my, carpet, which is, ordinary carpet. It's not a
Yeah, the
silk
drawing
and
room generally has a carpet. Yeah.
yes, उस पे बैठा हुआ था वहाँ पे. So that house was made, and that is, Kashmiriyat of my this thing. And my this thing is that Kashmiri Pandits, one by one, should go back to Kashmir. Obviously, everybody will not go there in good jobs, but they should take example of a few people like me.
For years, my mother has been the expert examiner or controller of exams or the chief guest faculty for Kashmir University and has quite a few PhD students who have passed out from under her. And they are now as the lead faculty in various universities, mainstream Kashmir University, Agricultural University. So the kind of culture, the kind of warmth, the kind of affection that we gather from Kashmir is beautiful. It's
Yeah,
a beautiful place.
it's very
अगर
difficult.
कहीं पर जन्नत है तो यही है हम ही
Yeah,
हंसो हम ही हंसो हम
yeah.
ही हंसो.
It's very difficult to describe the warmth you get there. You can't describe it, you can't write it. You can only feel it when you go there.
True.
And I feel it. That is the reason I can do anything for anybody, especially for purposes of Kashmir.
Anything, sir, that you'd like to share with the audience, which is in your heart and which has been missed out?
No, I think you covered many things, but I would only once again emphasize that we must do our best wherever we are. Since we're addressing mainly the doctors, do your best. We are, expected to heal. Do your best in that, especially in this era. This, we're going in second phase. I'm sure third phase is going to come. We have to see that, we educate people who do not know about COVID, and then don't allow non-COVID patients to have problems because these days you're not getting any beds for COVID.
Right.
And what's happening to people who get a hypertension, out of control diabetes? Do something for everybody, and that is the way we have this Hippocratic oath and other things. But you remember that you are a doctor. You have to be empathetic. You have to
Where do
listen.
you see yourself, sir, as a cardiologist in the years to come? And where do you see cardiology going in the years to come?
Cardiology is progressing so rapidly. The artificial intelligence, like in any other subject, is coming in so fast that it is going to make the life of future cardiologists very simple because of AI and
The AI is invading every aspect, sir. Even
absolutely.
joint replacements, spine surgeries,
That's right.
neurosurgeries, everywhere.
You can improve your outcomes without in a short period of time. You can do those procedures. Your treatment algorithms will come in front of you. What do you want to give? So you don't have to cram like I used to cram in my school days all the time. रट्टा नहीं लगाना पड़ेगा, सामने आ जाता है. So that's what I would say, that
This
be
brings us to the close of this session. As I learnt about you, from you, through you, on this platform of Omnicurious in the show Legends of Medicine, Dr. Upendra Kaul is a doctor par excellence with a success story of more than 40 years into a dedicated field with hard work, a gentleman for whom nationalism means hard work, an astute clinician, a fond Kashmiri at heart, a giver, a helper, a healer, a person who believes in action, who looks forward to many things in life. And of course, we would be more than delighted to read your autobiography in the years to come. With this, I come to the end of the show. Any last comments, sir?
Thank you very much, Puja. It was wonderful interacting with you and my fellow doctors, and what you already said, that work hard, be a nationalist, do well, keep country in front of you. We should become number one in everything. Thank you very much.
You're most welcome, sir. Thank you. Bye-bye, friends. Stay safe. Stay good. We'll see you next episode yet again. Thank you.